All right, a couple of hints, tips, and tricks about blood pressure cuffs overall, okay? So what I have here on the table are various sizes of blood pressure cuffs that we're gonna talk about. In this case, size does matter. We need to make sure that we have an appropriate size blood pressure cuff on our patient so that we have an accurate reading, okay? This top one up here is a regular size cuff. So it says like adult large on here. What we're gonna start with here, kind of these tubes. There's some tubes, two tubes that will hang off of the blood pressure cuff. The first tube is connected to the dial, okay? So on the dial, you have an arrow or a needle that is, as you pump, is gonna go up. The dial has little markings. There is a number every 20 markings. And there's another dark marking in between there, so that's in increments of 10. In between those, every small hash mark is an increment of 2. Blood pressure is measured in millimeters of mercury. So you'll see little m, big H, little g. MM for millimeters. Hg is the periodic table symbol for mercury. So that's how, if you see that after a blood pressure reading, you'll see mmHg. And that's what these are measured in. Now, in the old days, we would use actual mercury, but these are aeranoid, so we're using more air, so it's safer for both us and our patients, okay? But it's still considered measured in millimeters of mercury. So again, increments of 20 where you see the numbers. There's a dark line in between, so all the dark lines are increments of 10, and then the small hash marks in between are increments of 2, and that's how we're gonna measure blood pressure. All your blood pressure, unless you're using a digital cuff, will be even numbers because they're in increments of 2. So that needle's gonna go up. The first sound that you hear, you'll make note of, and that's your systolic number, the top number of your fraction. The last sound that you hear, you're gonna make note of that number in your head, and that's your diastolic number, your bottom number of your fraction, okay? So that's your dial, how it's broken down. Right away, you're not gonna be able, you're gonna kind of have to go, oh, was this mark right here, and kind of come back and figure out what mark that number represents, okay? So that's what you're gonna kind of keep track in your head, if you will, on the dial. So it takes a little practice. Again, I have a practice video on the Blackboard to kind of help you through that and kind of see what's going on. The other tube that comes off is your, has a valve and a bulb. This is considered the blood pressure bulb. So the valve, if you have it to the right, you're gonna go forward to lock it, and you don't wanna lock it real tight, just a little bit to stop it, okay? If you have the valve to the left of your hand, then if you pull towards, you roll towards, you real lightly, that's how you're gonna lock it. So it just depends on how you hold the valve. Do not hold your blood pressure cuff valve like this, because then after you have it pumped up, you gotta twist it in your hand to get to the valve. So the bulb should be in the palm of your hand, the valve either on the right or left side between your thumb and forefinger, okay? So that you can manipulate it forward and back as you're taking a blood pressure. All right, so those are the tubes. Inside of the blood pressure cuff, then from here to here is what we call a bladder, okay? It's the same material as this, but that's where the air that you pump up is going into, putting pressure on the patient's arm, all right? And then this is just the covering. These are replaceable, can be disinfected as needed, etc. Okay, so the outside of the cuff then, we have a marking on here that says artery mark. That's what we're gonna put over the patient's brachial artery. It doesn't have to be exact, just kind of in the general area of the patient's brachial artery. This is the outside. The inside, this side is what's gonna go next to the patient's skin. On the inside, some of them will have an artery mark on the inside, but you can't really see it, so it's not that big of a deal. But we do have a range down here. So like I said, it does matter what size cuff you put on your patient, it should fit that patient. So we have a range, minimum to maximum here. If your cuff, as you wrap it around your patient's arm, there's an index line. If that index line falls out here, out of range, you need to get a larger cuff. If it falls on this side where it says select smaller cuff, obviously you need to get a smaller cuff. This patient's arm would be really small, as you can see, so you may have to go to a child's size cuff. Some people just have really skinny arms. But it should fall as you wrap it around the patient's arm. This index line right here should fall within this range, okay? 1/3 of the width of the patient's arm is typically what the rule is. It's very nice. Cuffs nowadays have those markings. We don't have to guess anymore, all right? So this is a regular adult size cuff. This particular cuff is a cute little kid's cuff, same types of markings. This is the outside. Here on the inside, we have, it says this side against limb. Here's our artery mark. Here's our range. Here's our index line as we wrap it around the patient's arm. This is a large cuff. If you fall outside where it says select larger cuff on this one, you'd go to this size cuff. So this is an adult large cuff. So again, on the inside, this part against the patient's limb, we have an artery mark. We have our range, and this is going to be wrapped around the patient's arm, and it needs to fall within that range. Then, of course, we have the cute little itty-bitty infant cuffs for little guys. So again, artery mark on the outside and inside here, wrapping around, it should fall in that particular range. Then this last one here, this monster guy, this is a pretty good size cuff. If your patient's arm, you put the large cuff on, it's still too small, then you may have to go to what we consider this is called a thigh cuff. You can take a blood pressure in a thigh. You would do that if the patient was more an amputee than big, because if you have a large obese patient and their arm is too big for that, their thigh's probably going to be too big as well. So you can use the thigh cuff on the arm. What I recommend is if you don't have a thigh cuff, one of these monster cuffs like this, I would go to the largest cuff size that you have, and you can take a blood pressure in the forearm, okay? And I'll show you in class how to do that. You put it on the forearm, you're gonna palpate the radial pulse, and that's the radial pulse is where you're gonna put your stethoscope, okay? So, like I said, probably more so in 180 than here in 130 is where we'll practice those forearms. But if you get really good at taking a blood pressure and you feel confident and you wanna try a forearm blood pressure, go for it. It's always kind of a good skill to have, and clinical sites really like it when students know how to do a forearm blood pressure. It is much harder to hear, and it is a little bit more difficult. So again, don't get frustrated, all right? So that's, I think, pretty much everything we have for the cuffs. Hopefully this was helpful.